Hello guys, welcome back to Mid Baby YouTube channel. So this is a short video about the development of placenta. I'll emphasize on the questions mostly concentrated about placenta. I'll talk about that. So the placenta having two components. So there is maternal component of placenta as well as the fetal component. So we get the questions like what is a maternal component of placenta? So the answer to it will be decidua, and also which part of decidua, which is basalis part of decidiva. And the fetal component of placenta is the villus chorion. So in this diagram, I would like to take your attention to this diagram. So here we can see the primary chorionic villi, which is formed when the cytotrophoblast invading into the syncytial trophoblast. Before that, what I would like to remind you about what is chorion. So chorion is formed by three structures, which is extraembryonic mesoderm, the somatic part of extraembryonic mesoderm, the cytotrophoblast and syncytial trophoblast. And the primary chorionic villi is the cytotrophoblast invading into syncytial trophoblast, and the secondary chorionic villi is formed when this somatic extraembryonic mesoderm core also invades into the primary chorionic villi. Then we have the secondary chorionic villi. But the component of placenta, the fetal component, is this one, which is the tertiary chorionic villi, which is also called villus chorion. So in tertiary chorionic villi, there will be blood vessel formation. That is, the somatic part of extraembryonic mesoderm some of it will differentiate into blood vessels, and thereby we form the tertiary chorionic villi. So the component of tertiary chorionic villi will be the blood vessel, the somatic part of extraembryonic mesoderm, the cytotrophoblast and the syncytial trophoblast. So this is formed on the 21st day, and this is the fetal component of placenta. And here we can see the placenta. So placenta consists of two components, that is maternal component decidua basalis and the fetal component, which is villus chorion. And now some words about decidua. So decidua, what it is decidua? Decidua is nothing but the uterine endometrium during the pregnancy. It is the uterine endometrium, but during pregnancy we call it by a specific name, which is called decidua. And why it is called decidua? Decidua is a term which we use for a particular type of forest where in some particular period it sheds off its leaf. So we compare the uterine endometrium during pregnancy and we call it as decidua because after the pregnancy this endometrium will shed off, like after the childbirth. So that is why it is called decidua. So this decidua consists of three parts. There is decidua basalis, there is decidua capsularis and decidua parietalis. So but only the decidua basalis part will form the component of placenta. So in this diagram we can see the different parts of decidua. So this is decidua basalis. Okay, so this decidua basalis is between the myometrium part of the uterus and the fetus. So that is decidua basalis. Then we have the decidua capsularis, and this capsularis is like a capsule. It is separating the uterine cavity from the fetus through decidua capsularis. Then the rest part of decidua, it is called decidua parietalis. So that's it about the development of placenta. It is developed on the 21st day or the third week with two components. The fetal component is tertiary chorionic villi and the maternal component is decidua basalis. That's it for the video. Thanks for watching. Support the channel by subscribing to it. Thank you so much.